Hi, I'm Dr. Bernie. I'm a homeopath. I'm located in the Gilbert, Arizona area, and I've been a homeopath since 1994. I studied in the UK, got my PhD in Hawaii some years after, and uh, and I have a wonderful clinic in Gilbert. It's Gilbert Natural Medicine, or you can go to gilbertnaturalmedicine.com and check me out and see what we're all about and what I do, what I work with. Um, some things are my specialties, but I work with everything, including all STDs, all neuroviruses, to kill them, to get rid of them, to take them out of your nervous system, not to just treat them so that you are living with this in your nervous system the rest of your life, because a medical doctor can't cure STDs and things like that, especially Lyme disease, which I cure. I'm not supposed to say cure, because of the FDA, but if I can't cure you, then I I need to find another job. Okay, so what I want to talk to you today about very briefly is depression and how to combat depression and what to do to help it along. Um, First of all, we're fighting this COVID thing, and so with COVID, it has locked us up in our homes, made us wear masks so we can't see each other, sanitizing our hands all the time, which is always a good idea. Closing businesses down, you know the routine for COVID. So for some people, that sets in some depression because you can't be with your friends, you can't associate with anyone, you can't get close to anyone. Um, you're safer indoors than outdoors, out and about. Well, that brings on depression for some people because it's depressing. But I'm not talking about that kind of depression. I'm talking about deep-seated depression. Now, if you are diagnosed clinical depression, then you need to be on some medication. When in that case, homeopathy could work for you. I have some other tips for depression. If you feel you are so depressed, you need to see a therapist, to have someone to talk to vent to that can give you some ideas what to do. That's fine. If you are going to go to your doctor and have them prescribe medication for anxiety and depression, it might be the wrong medicine, because if it makes you feel like you can't focus, you're not here on earth, wrong medication for you to be taking. If you're taking one medication for depression, you need physical mental therapy. There are depressions that stem from psychiatric problems to psychological problems, problems that cause depression. Some simple things are losing someone either through death or a relationship, not being able to work to your fullest, not be able to accomplish to make you happy, not being able to get up in the morning with and be about your day. These are signs of depression. Depression is caused by a sickness, someone else's sickness, someone you have to take care of with a sickness. Depression comes from everything. It comes from a low immune system. It comes from not being able to support your immune system with the right foods and things. Depression, the best I can tell you, is that we have certain neurotransmitters that work in our brain. Neurotransmitters are on the end of all appendages that stick out from your arteries and things like that. It's the very edge of appendages that come out from something main. Okay. These little transmitters send signals to your brain to produce. Some of the transmitters are adrenaline, noradrenaline, norepinephrine, epinephrine, GABA, serotonin, dopamine, and they all play a critical role in our bodies and how we function. There are neurotransmitters that help us sleep, help cravings, help us focus and concentrate, help our mood swings, fight or flight. They do everything. And so if you are lacking a particular neurotransmitter, you're going to have a problem. And some lacking of neurotransmitters, you could have depression. So what I would suggest, beyond some tips I'm going to give you in a minute, are ordering a neurotransmitter from me, because a transmitter test by a urine collection that you could do in your own home and then mail to the lab. I get the results and then I call you and then we figure out what you need. Homeopathically, I have all the homeopathic neurotransmitters. If you can get that test and I can mail it to you, you're on your way to helping yourself out of depression. Some neurotransmitters work on pain. They're unbelievable, and your doctors don't do these tests. Now, if I were a medical doctor, and I'm not a Western medical doctor, I'm a homeopath. If a patient came to me and said, I'm depressed every day of my life, I can't get it together. Or you have a child that is not functioning properly. I had a little 2-year-old boy patient, couldn't speak, couldn't interact, nothing. And I figured this child needed norepinephrine, so we did a test. Sure enough, he was lacking norepinephrine. So I put him on norepinephrine. Wasn't even a month later. He was a champion. He was playing with toys and interacting and speaking. His parents didn't know where he got all those words because they lock up in your brain, see? And so when you lack a neurotransmitter, it controls the body, the brain controls things. Now, you have hormones that control things too. And hormones are the number one key beside neurotransmitters that could cause depression. For instance, someone in menopause, someone that's low in hormones, whatever they might be, male or female. You lack certain hormones that cause you to feel depressed. It's mainly progesterone. Now, some doctors believe it's estrogen. Estrogen can be very dangerous, especially if you're a cancer patient or a recovering cancer patient. You never want to take estrogen. The best way to take a hormone is to take a natural hormone. And I don't mean a compounded hormone, because those are still drugs, they're prescriptions. I mean homeopathic. I don't mean herbs or vitamins. Those help, but they don't cure anything. It's good to take a really good vitamin for your body. I can make a suggestion, but it's not fair to everybody else on the block. So if you want the suggestion for good vitamins, you're going to have to call me. I'm at 480-703-0151 or gilbertnaturalmedicine.com, where you can schedule a 15-minute free consultation with me for whatever your heart's desire in health. Very easy to do, just that simple. So you've got a lot of reasons for depression out there, especially if you have fibromyalgia, if you have Epstein-Barr, if you have Lyme disease. You know, guys, if you have Lyme disease, you have no choice but to call me because I'm going to pull you out of it. Please don't live with Lyme disease so you have something to talk about with your Lyme disease friends. Some people, all you want to do is stay sick because you have nothing else to do. So that gives you reason to talk about your illness. And that's all the friends you have. People don't want to hear about your misery unless they're miserable themselves. Who wants to live like that? I don't. Do you? I don't think so. If you do, you're in trouble. Let's do a neurotransmitter test to see what your depression is. Give me a call, 480-703-0151. Let's take care of that today. Now, my tips for depression. It's going to take a little bit of work on your part. So you're going to have to really use your willpower. Number one, get out of bed in the morning. Drag yourself out of bed because people with depression love to sleep. You can sleep all day. We have all been there one time or another. We're human. We suffer these little ups and downs. It's nothing to be ashamed of, but it could be something to worry about if you're not careful. Drag yourself out of bed, get in that shower, clean yourself up, feel good about the day. Force yourself. Get into some clothes that you love to look at. Put on some great shoes. Go outside and smell the air. Doesn't matter if you're living in a snowstorm or in 110 degrees like Phoenix. It's life. Look at nature. Be a part of nature. You are never alone. I don't care if you live alone. You are never alone, which could be one of the reasons for your depression. Listen to me. There's birds outside to look at. They sing to you every morning. You got birds singing to you every morning. What else could God give you? What could be better than that? After you get dressed, after you fix your hair and you're looking good, do something. Start a project. If you don't want to do that, get on the internet. Research some things you might be interested in. Learn about things. I have a wonderful course in natural medicine that I offer. And you could get it by going to ArizonaAcademyForNaturalHealth.com and look at the syllabus in that course. Now, that course is $497. But if you tell me that you heard about it through YouTube, I will take $100 off that course. That's it, man, because it's a great course. Learn something while you're doing nothing in your depression. Learn something about natural medicine, how to take care of yourself, how to feel better, how to take care of those around you. And you know what? We're fighting some tough times right now. You don't need to run to a medical doctor every second. You have the sniffles, you run to the doctor. You can take care of this stuff yourself. Now, you can't do it without a doctor if you have high blood pressure, if you have diabetes. Those are the most important things you need medication for. Prescription medication to keep you on track. But even that medication may make you feel sick because they have to guinea pig you first to find out what your milligram would be, what your dose is. So everything in medication is a guinea pig proposition. That's just the way it goes. Once you get out of bed and you get all dressed and you go outside and you smell the air and you are thankful for another day because you woke up. I used to own nursing homes and I'd say, good morning to my patients. And they'd say, yeah, for what? What's good about it? And I would tell them, listen, you woke up, right? It's a good day. Trust me. If you didn't wake up, you wouldn't give a damn about the day, would you? Okay. Guess that makes sense. Then you're going to have to find something to do with yourself during the day. Clean your sink, put your dishes away, clean the floors, Sweep the house. Make the house look more inviting to you. Change your furniture around. Do stuff. Don't go back to bed. The minute you wake up, make your bed. Do not allow yourself to go back to bed. Now, you might want to watch some TV. Don't fall asleep on the couch. Don't do that. You might want to listen to some medicine. Might want to listen to some music. Don't fall asleep listening to your music. Be happy with yourself. If you can't be happy with yourself, no one else can be happy with you, because that's the way it rolls. You need to take care of yourself first before anybody else is a part of yourself, in your life, in your space. So make your space a comfortable place for you to relax in and to be thankful that you have. You know what, guys? I don't care if you're homeless. That's your space. That's what you have. Be grateful for the things you have. Count your blessings. That should keep you awake for a while. Everyone has blessings, but when you're depressed, you don't see these blessings. If you need more help and you don't want to hire a therapist because you don't want to talk to somebody you really don't know anything about, you're never going to know what your therapist is all about. He could be fighting his own problems. What do you know? Even your psychiatrist. What can I say? Again, we're human. We have our faults. We have our little ups and downs. It's very simple to overcome anything you want to overcome. If you're looking for a job and you're depressed because you don't have one, create one. If you can't find a job, it's an excuse. You don't want to work. Because there's jobs everywhere in the United States, in your state. You just don't want to work. There's something for everyone to do. Like this person trying to call me right now. Oh, well. What can I say? My mistake. Sorry, guys. There's something out there for everyone, and something for everyone to enjoy, even if it's a bowl of ice cream. If you have no car, take a walk. If you have a pet, adore your pet. Talk to your pet. They'll listen. That's what they're there for you to bounce your stuff off of your mind, your emotions. They absorb you. They're doing you a favor being your friend. Be their friend. Never harm or hurt anything or anyone, because you're part of that life cycle and you don't want to hurt anything that will hurt you, because what you give out, you're going to get back. Trust me, only 10 times worse if it's negative. Now, I can't sit here and tell you, be positive, wake up in a positive mood, be positive all day. That's not going to happen, guys, because that's not reality. We're not going to be happy every day we wake up. But you have to have a little bit of motivation to get started. I'm Dr. Bernie Masseri, 480-703-0151, if you want me to be your homeopath. It's just that simple. Thank you for listening.